Leslie Dach is the founder and chair of Protect Our Care. On November 5th, voters will go to the polls. How important will healthcare issues be to them?
Very important. I think, most Americans struggle with the affordability of healthcare. Many skip the doses of the drugs they need to stay alive because they can't afford them. It's, of course, an issue that it holds true for everyone in America, no matter what their political party is or where they live. So it's both a deep economic issue and, of course, a matter of life and death to many.
Are healthcare issues getting enough attention from the political parties?
Well, they seem to this year. I think Kamala Harris has certainly made it a major issue to talk about the work that the administration's done to reduce the cost of drugs, to make healthcare insurance more affordable, to safeguard the Affordable Care Act and Medicare. And I think the Republican candidates have tried to stay away from it, but because their positions are basically unpopular. But when Trump talked about concepts of healthcare in the debate, and then J.D. Vance followed up with an attack on pre-existing conditions, it's gotten right back into the fore.
How would you assess the state of healthcare in the United States today?
Well, unfortunately, it depends on where you live and what your economic condition is. So, those folks who can afford high quality healthcare and not think about it, can afford insurance and not think about it, can afford their drugs and not think about it, they enjoy good healthcare. Even though overall our system underperforms, despite how expensive it is many other countries. But if you live in a rural area, you're a working family who's just making enough to get by, you're in trouble.
You mentioned that we're underperforming compared to other countries. Why?
Well, our healthcare is very expensive and our outcomes aren't as good. And that's a long, complicated issue to solve, but it's important for Americans to know that.
What types of policies do you think would best address those problems?
Well, one of the things is to just simply make healthcare affordable for more Americans. And we don't have that now. The ACA has gone a long, long way to make that, to make it affordable for everyone. The lower cost provisions of the Inflation Reduction Act to lower the cost of drugs and prescriptions has made that the healthcare far better for our seniors, and a vibrant Medicaid has made it far better for those who need assistance because their salaries are too low to afford decent healthcare.
So when voters are polled about their views on healthcare, does it break down on partisan lines, or do you find overlapping interests?
No, it's one of the few bipartisan issues with the American people. For example, polls just came out today on the issue of Medicare finally having the power to negotiate for lower drug prices. 88% of Americans support it, including 85% of Republicans. Those kind of bipartisan numbers are not numbers you see on other issues. Practically the only place that healthcare is not a bipartisan issue is in the halls of Congress, where the Republicans, for some reason that I frankly don't understand, have voted against the Affordable Care Act, voted against lowering the cost of prescription drugs, and are threatening to undermine all those provisions.
Now, you mentioned the power to negotiate for Medicare. Can you explain what the current system is and why it's important why you think it's important that it had the ability to make those negotiations?
Well, the current system is that drug companies can basically charge whatever they want for their drugs. And they are some of the most profitable corporations in America, but they have complete ability to just charge what they want and make incredible profits. And that's because they have fought the ability of Medicare to negotiate for the price of drugs. I worked at Walmart on the executive committee there for 7 years. And, everybody at Walmart, we certainly had the right to negotiate for lower prices for our customers. But Medicare was denied that right. And so here you have basically no one to negotiate and move the prices down. But thanks to the Inflation Reduction Act, which passed Congress without a single Republican vote, Medicare now has the opportunity to negotiate for lower drug prices. But it's important to understand what these drug prices did to people. 1 in 4 seniors say they can't afford the cost of their drugs. They skip doses that they know are necessary to stay alive. They have to choose between paying rent or buying food and paying for their drugs. So this is not an abstract issue. This is a very critical issue for people. And the Inflation Reduction Act did a number of things to lower the cost of drugs. It allowed for the first time these negotiations so that the government could negotiate with these drug companies for a fair price. It has, starting in just 2 months in January, no senior will pay more than $2,000 a year for their drugs, no matter how expensive they may be, whether they have really expensive cancer drugs. Those will be capped at $2,000 a year. Drug companies will no longer be able to increase the prices of drugs more than inflation, which they had been doing year after year after year. And the result of that will be that that seniors on Medicare will now be able to afford the drugs they need to stay alive. And the other thing the bill does is it now, for the first time, caps the cost of insulin at $35 a month, where people were paying hundreds of dollars before. You add all of that together, and you have now made drugs affordable for America's hardworking seniors.
Now, you also talked about the Affordable Care Act, which is popularly known as Obamacare. What are some of its key features?
Yeah, well, I think that's, what people, start focusing on is that, it gives people an opportunity to afford health insurance. So we have approximately 24 million Americans, the vast majority of who can get some financial subsidies, so they can afford the health care they need, and they now have affordable health care insurance and everything that comes with it. But that's only one part of what the Affordable Care Act does. It protects every American with pre-existing conditions, guarantees them the right to have health insurance, and guarantees that they won't be charged more or denied coverage simply because they have a pre-existing condition. That is, over 100 million Americans. It makes sure that kids are covered until the age of 26 in their parents' policy. It eliminates lifetime caps, which used to be that once you had $1 million, which seems like a lot of money, but it's not under the current system. If you get really sick, the insurance companies could no longer insure you at all. Now you're going to have insurance throughout your lifetime as a result. It guarantees free preventive services for people. So mental health care, mental health screening, cancer screening, free vaccines. All of those things are now basically free for people because of the Affordable Care Act. And the Affordable Care Act also guarantees that insurance is of high quality, whether you're on the ACA or not on the ACA, private insurance or government insurance. So now, women can't be charged for extra for maternity care. All prescription drugs are covered. All of these critical services that before you had to pay more for, you now get as part of your insurance, and that's true for anyone who gets insurance, whether it's from their employer or through the ACA.
What are some of the differences in the approach to the Affordable Care Act between Vice President Harris and former President Trump?
Well, there are far too many, and people need to understand them. So, starting with Vice President Harris, she wants to be sure that the law is strengthened. She wants to be sure that the financial assistance that people get today continues. Republicans are on record, the president and to very clearly, and many others, including many of those running for statewide office in Pennsylvania, want to take away the financial support that people get now to afford their insurance. Putting, I'll get the exact number, but putting over 1 million people in Pennsylvania at risk of no longer be able to afford their insurance. And I think the differences are even starker. Well, let me back Donald Trump tried to do when he was in office. He tried to, under his watch, he tried repeatedly to repeal the Affordable Care Act. He has not said that, he's kept that on the table. In his debate appearance, he was very clear that if he could get rid of it, he would. He talked about his concepts of a plan, but his intent is very clear. So without doubt, they will take away the financial assistance that people get to afford their insurance. But they will also very likely try and get rid of the law as a whole. And I would also say that, it's not, there are a lot of ways you could sabotage the Affordable Care Act without repealing it. So they have many tools to take healthcare away from people. But the starker, as stark, maybe even more stark, is what Republicans and Donald Trump want to do to pre-existing conditions. J.D. Vance basically attacked the law's provisions to guarantee people with pre-existing conditions insurance. That would affect, as I've said, over 100 million Americans. I think it'd be useful to go through if you bear with me, to go through some of the numbers, because in Pennsylvania, these are not abstract issues. They affect the lives of millions of residents of the state of Pennsylvania. So over 1.5 million Pennsylvanians have health insurance coverage, either through Medicaid expansion or through the ACA in Pennsylvania. 2.4 million Pennsylvanians are on Medicare, enjoying all the benefits of reduced drug prices that I mentioned before. Over 5 million Pennsylvanians have a pre-existing condition and are now guaranteed affordable health care for the rest of their lives. Almost 500,000 Pennsylvanians take those drugs, that first 10 drugs that have been negotiated, and they will save significant amounts of money. 645,000 Pennsylvanians will benefit from this $2,000 cap that I mentioned, and almost 400,000 Pennsylvanians benefit from the financial subsidies in the ACA to lower their premium. So all of those people, all of those families, these are huge numbers of Pennsylvanians who rely on these two democratic achievements to have affordable health care and stay alive and healthy.
The Hill reports that Trump's health care plan would focus on deregulating the insurance markets to promote choice. How would that impact health care provision in the United States?
Well, I think it sounds good, but it's very dangerous and very misleading. Let's go back to the time before the Affordable Care Act. Insurance companies could sell you policies that didn't cover you when you were sick. They could refuse to cover you if you had a pre-existing condition. And if they did cover you, they could charge as much as they wanted. And the list goes on. So what sounds like it's, and they could sell you policies that didn't cover maternity care. If you were a woman and all of a sudden, if you got pregnant, you'd be charged more. They could sell you policies that didn't cover mental health care, and on and on and on. So as a result, it may sound like that's great. I can just buy what I need. The fact is that was a system that left people at the mercy of insurance companies and without coverage when they got sick. And what the Affordable Care Act did was to both help reduce the cost of premiums for millions of Americans, but also guarantee they had insurance that really mattered. Plus all the other, plus being sure your kids could stay on until 26, plus getting free preventive services and other benefits like that. So it was very, very different. And Americans are far better off because there are now standards for what good insurance means.
What kinds of differences do you see among different age groups with regards to healthcare policy?
I think it's actually, when you look at it, it's interesting. Healthcare is one of those issues that, is the same no matter where you are in America. If you live on the coast, you live in red countries or blue countries or rural areas, basically your feelings and the impacts are all the same. Because healthcare doesn't discriminate by where you live. It doesn't give you a break by where you live. it affects all Americans the same way. So I think what we find is that no matter where people live in America, no matter what political party they are, they all have the same concerns about the affordability and quality of their care.
In 2022, the Supreme Court issued its Dobbs decision overturning Roe versus Wade. How has that decision impacted women's health?
Well, in so many ways, and also their mental health as well. And we've seen in the last since that decision was made by the Supreme Court that women have lost their lives when they cannot get the abortions they need because when their life's at risk, because doctors are afraid of the repercussions. We have seen the loss of reproductive freedoms in so many states in America. And this is an area, of course, where the distinction between the two parties could not be more clear. The president said President Trump said, the elimination of Roe was one of his greatest achievements. J.D. Vance has said the same thing. David McCormick is on record also supporting the Roe decision. And this is another example of how when politicians don't tell the truth, because he then went on his website and took that content off his website because he knows how unpopular it is. But this is perhaps the starkest contrast between the two candidates for president and many local races.
Vice President Harris has proposed broadening Medicare benefits to cover home health care. How significant is that?
Well, very much so, because most families cannot afford the care that they need for their loved ones as they aged, or for their own care at home or in a nursing home. And therefore, this is, that kind of support will help many millions of Americans. That's not the only thing she wants to improve about in healthcare, and particularly in the drug area. She is on record, and Republicans are opposing this, to extend the benefits of lower drug costs that are in the Inflation Reduction Act to everyone on insurance, so that everyone in America who has insurance would only pay $35 a month for their insulin, that they would all benefit from a $2,000 annual cap on the cost of drugs. So one of her major planks is to extend these cost-saving reductions that are in the Inflation Reduction Act to everybody who has insurance, not just those on Medicare.
What types of policies on mental health, affordability, and availability do you think should be implemented? Well,
one of the things we have to do is preserve the ones we have. So there are the mental health screenings that are guaranteed by the Affordable Care Act, or under risk by Republican policies, by Project 2025, by Donald Trump. And we need to protect those. We need to be sure, as this administration has done recently, that there's parity between mental health care and other kinds of health care and people's policies. So for a long time, your insurance companies underinsure you for mental health services, and we're trying to have that become the same, that you'll get the mental health care you need when you need it at an affordable price.
How significant is access to contraception for health care?
Well, very important. It is one of those essential health benefits that I mentioned before, so that free contraception is guaranteed by the ACA for those who want it. And that would be at risk and be gone. That guarantee would be gone if the Affordable Care Act was substantially altered. It also points out to another difference between the strong contrast between the Republican Party today and Donald Trump versus the Democratic ticket, which is there are lawsuits underway now where people are saying we have to eliminate all of these essential health, preventative healthcare services that over 160 million Americans rely on and don't have to pay for. And including in that would be overthrowing the right to free contraception. And it is 100% sure in my mind that one of the ways that Donald Trump, if he were elected, would destroy our healthcare is he would simply refuse to defend the ACA in court. And those key provisions that are under attack by MAGA extremists would not be defended by the federal government anymore.
Now, one of the key issues over the past several years has been the closing of rural medical facilities, creating what some people are calling healthcare deserts. How significant is this, and what types of things can be done to address it?
Well, it's significant for anybody who lives in those areas. And it also ties in with the reproductive rights questions that you asked, because one of the things that we're seeing is that in those states that have moved to ban abortions, obstetric and gynecology practices have left the state. There's too much risk for them to do their job. And so if you live in a rural state that's also banned reproductive rights, then you're also now don't have the obstetrics and gynecological practices that you need to have. So that's a big issue. And the other thing that I think people need to understand is that Medicaid and the ACA keep rural hospitals alive. Why is that? Because people now can afford to go to those hospitals and their bills are paid. So thanks to the number of people enrolled in Medicaid and Medicaid expansion and the ACA, hospitals get paid for their services, whereas before they would have to offer them as charity. So both people would not get good care, but also the hospitals would suffer because they weren't getting paid for the care they were giving. And so if you eliminate the Affordable Care Act or you weaken some of these other provisions, then these rural hospitals suffer because people can no longer afford to pay them for their services.
Now, another issue, and somewhat related to that, is the labor shortages among primary care physicians and nurses and other medical practitioners. How serious an issue is that, and what can be done to address it?
Well, I think any of us who've picked up the phone and tried to get an appointment with a specialist and with a primary care physician knows how hard it is to do that. I'm on Medicare. I called, so I know, I'm experiencing and benefiting firsthand from this. But there are waits of months, and it's particularly true if you're a person of color, where we don't have enough people of color in the medical profession in these areas who understand you, who respect you. And so that's another issue. And that requires, people elected to Congress and to statewide positions who care about this. And it certainly is something that Kamala Harris has spent a lot of time on, similarly with maternal and child health care, where we have in America far too high a rate of maternal deaths after pregnancy.
You're the chair of Protect Our Care. Tell us about your organization.
So my career in healthcare, my last job was as a senior counselor to the Secretary of Health and Human Services in the last few years of the Obama administration. And when Donald Trump came into office and threatened the repeal of the Affordable Care Act, those of us who had spent big chunks of our careers in healthcare and passing that law and working hard to make it work, we just couldn't go away quietly. So a number of us formed Protect Our Care, and we've now in our 7th year, and we've evolved into one of the major advocacy groups in Washington that focuses particularly on saving these laws and guaranteeing affordable, equitable healthcare for everyone. It's a battle that unfortunately continues to rage. And I think your questions, today on this are very, we're out there also we're not an electoral organization. We don't have a PAC, but we have very clear points of view about healthcare. And I think everybody listening to this should understand that healthcare is on the line in this election, that there is a huge difference between the policies of the Democratic Kamala Harris and Donald Trump. Donald Trump will take away healthcare for millions of people, make it unaffordable for millions more. We'll side with the drug companies and the insurance companies and not with everyday American citizens. And the same thing's true, unfortunately, for many of the people running locally in Republicans running locally in the state of Pennsylvania, including the Senate race.
Leslie Dach, founder and chair of Protect Our Care, thank you for joining us.
Thanks for having me, and thanks for taking the time to talk about this critically important issue.